Hello students, in this session we will be discussing about blood supply of head and neck. So, the whole head and neck, which are the arteries which supplies blood to different organs, we will be discussing that. So, this simple concept you can learn like the river map of India. In our country India, we have got so many rivers. Every state has got major, minor rivers, 7-8 rivers are there. It supplies every area. Now, if any farmer, if he has an agriculture field, does it mean that the river will supply to his agriculture field? Definitely not. From the main river, a small tributaries are made. Through the tributaries and small tributaries, that agriculture field is irrigated. Same way, in our body, we have heart. And from the heart, the blood is pumped to different parts of the body through arteries. So, the artery is the river and the heart, you can call it like a glacier. Like the river Ganga or Ganges, it starts from Gangotri. Same way, this is the river is artery and the heart is Gangotri. Now, what is an artery? So, artery is a muscular tube in which the blood travels. Now, if you see this particular diagram, a photograph, you see that this is a national highway and now different cars are traveling inside that road. So, there is red color, white color, so many different shapes and sizes of cars are there. Similarly, the road is an artery and inside the artery different cars you are having, you are seeing the cars inside the road. So, the red ones are the RBCs, red blood cells, white ones are the WBCs and small cars are the platelets. So, this is just a simple concept what I have told. Now, everything begins in the heart. Our heart has got 4 chambers, right auricle, right ventricle, left auricle, left ventricle. So, that you will be discussing in the cardiac cycle. Now, here you see that there is aorta and from the aorta 3 branches are coming up. That is our area of focus. So, the blood supply of head and neck, it starts from your heart and from arch of aorta. Where is this arch of aorta? At the level of second intercostal cartilage. You have got ribs over there, first, second, third, 4, 5, 6, 7 ribs. So, between the first and second or second and third in that particular area, intercostal cartilage, that area inside you have got your arch of aorta. So, now arch of aorta has got 3 branches. Now, let us assume like the arch of aorta is a grandfather. So, grandfather has got 3 kids. The 3 kids are 1 daughter, 2 sons. So, the first branch of arch of aorta is the right brachiocephalic artery, right brachiocephalic artery, and it has got 2 boys, that is left subclavian artery and left common carotid artery. So, both the left ones we can brand them like boys and the right one like a girl. For a father, the girls are always right. So, we have got right brachiocephalic artery. So, right brachiocephalic artery got married and then again got 2 kids. So, please understand that it is right brachiocephalic artery is a direct branch of arch of aorta. So, right brachiocephalic artery got married, 2 kids. So, it is the 2 kids name and the family name is right. So, the branches of right brachiocephalic artery is right common carotid artery and right subclavian artery. So, this right subclavian artery we need not bother much. So, this right common carotid artery is our area of interest. So, this right common carotid artery again gets married and 2 more kids, that is external carotid artery and internal carotid artery. These 2 are very important. And now, if someone asks you what is external carotid artery? So, external carotid artery is a branch of right common carotid artery, which in turn is a branch of right brachiocephalic artery, which in turn is a branch of arch of aorta. So, the point to be noted here, the left common carotid artery and the left subclavian artery are direct branches of arch of aorta, whereas the right ones are the sub branches of right brachiocephalic artery. So now let us focus on external carotid artery. So now external carotid artery has got 8 branches, and these are the ones which supply our head and neck. You read any chapter, these 8 arteries will be there. Now these 8 branches, how to remember? So the mnemonic goes something like this, that is, some losers fail anatomy, other post magnificent scores. So some losers fail, we can brand it as part 1. Anatomy has part 2. Other post has part 3. And the last one is the magnificent scores, that is the 4th part. So that we can relate like a train, what you are seeing. So there is an engine and there is a guard. So the starting point and the terminal part. So the some losers fail, which is in the beginning. So these are called as anterior branches. Magnificent scores are in the last, so they are terminal branches. Anatomy is the medial branch and other post is the posterior branch. Other post, so posterior branch. So in between anterior and the posterior branches, we have got medial branch. So which is very clear from this flow chart. Now, so anterior branches are some losers fail. So now the arteries will come. So the anterior branches are superior thyroid artery, losers lingual artery, fail facial artery. So these 3 are the anterior branches, whereas your medial branch is ascending pharyngeal artery. Then OP, posterior branches are occipital artery and posterior auricular artery, and the terminal branches are magnificent scores, M for maxillary artery and S for superficial temporal artery. So your external carotid artery has got 8 branches, which are again divided into anterior, medial, posterior and your terminal branches. So this is a very easy method of remembering. Some losers fail anatomy, other post magnificent scores. Please learn this. Thank you.